Hi Robin, my name is Dr. Grimes. I know so far you've received a lot of information, and I know that a couple of doctors have come in, and unfortunately I am just here to give you more information. But as much as I hate to say it, all this information is very important in getting you not only the treatment you deserve, but also what is best for you. So, I'm here to talk to you about heart disease. Now, this term can encapsulate a lot of different problems. It's sometimes things that have developed since birth, and other times a result of certain lifestyles, depending on what kind of heart disease you've developed. There are a wide variety of defects, again, like I said, under the kind of umbrella term of heart disease. Things that normally develop from birth can include abnormally shaped blood vessels, missing or defective heart valves, abnormal connections between the heart and the arteries/veins, and even defects in the walls that separate the different chambers of the heart. Things that are normally a result of lifestyle choice are things like atrial and ventricular septal defects, coarsication of the aorta, aortic, mitral, pulmonic, and tricuspid valve defects, and tetralogy of the phalate. So there are a lot of different symptoms for all of those different defects that can happen from heart disease, but things like palpitations, fatigue, chest pain, and sometimes breathing difficulties are very common symptoms of a lot of different aspects of heart disease. So the one good thing about heart disease is that many of the aspects of it can be treated with medications. So there are lots of different things like diuretics, beta blockers, digitalis drugs, anticoagulants, and angiotensin converting enzyme inhibitors. All of those do different things depending on what kind of defect you have. But unfortunately, there are also many aspects of heart disease that require sometimes major surgeries. So there are lots of conditions that require this, and sometimes these surgeries can be replaced with minimally invasive operations instead of a full open heart surgery. But for some diagnoses of heart disease, unfortunately, there is no other option. So that's just kind of an overview of heart disease in general. Like I said, it's a blanket term for different diagnoses, and you don't have to have all of them to have heart disease. Just one is plenty for one person. So some of which these complications and others have long-term effects and have lasting effects, and some of them are just minor complications. So I just wanted to give you an overview of kind of the major symptoms and treatments before Dr. Akshaya, Dr. Hannah, and Dr. Michelle talk to you about some more specific forms of heart disease and some diagnoses that you might have and how to treat them. So I wish you all the best.